There we go. Um, and another announcement that I want to make before I go forward with the presentation is something that a lot of you are already aware of, but not everyone, which is that I will be leaving Neon for another job opportunity. My last day is May 20th. And one of the things I am most sad about leaving Neon is these seminars have been so fun for me to do, and all of you have been so wonderful in taking advantage of them and implementing them with your patients. It makes me really happy to see that. So I wanted to just say thank you for those of you who have been coming to these seminars. I really appreciate it, and that I will miss it. And if you have any questions about what it means for me to be leaving, feel free to follow up with me afterwards by email or phone. And I will definitely miss this. So with that in mind, this will be one of our last seminars. Hopefully it'll be a good one. Let me get rid of these other tabs. It's going to bother me. All right. So today we're talking about intimate partner violence. We go over these main categories. Talking about the problem and how common it is. We're going to talk about what it looks like in healthcare settings like Neon. We're going to talk about what we can do about it. What are appropriate interventions for this setting? Well, talking about defining this from the start, intimate partner violence is more than just physical abuse. So we think about it as being physical abuse. It used to be called domestic violence, which kind of came from the assumption that this was something that occurred only between people who were married, for example, within families. And intimate partner violence expands that idea that this is something that occurs between people that are in some sort of intimate relationship, regardless of whether they're married or not, or even together or not, living together or not, dating, etc. That people who are in an intimate relationship, violence occurring within that is something that is a common phenomenon. And is pretty common. We can see these 1 in 5 women, 1 in 7 men in their whole lifetime have experienced some type of abuse. So that beyond physical can include sexual, verbal, emotional. Digital abuse is kind of verbal, emotional abuse that occurs through social media, or controlling behavior that occurs through social media or through technology in that way, and financial abuse as well. All of these types of abuse are often co-occurring, going together, and they're all a form of abuse that is really damaging for people. I think sometimes we tend to just focus on the physical abuse, thinking that is the most concerning, instead of realizing that all of these aspects can cause real harm. So one of the things we understand about intimate partner violence is that it's a pattern of behaviors. It is rarely just one thing. It's usually a pattern of connecting things that all fall under, typically, power and control. So what I mean by that is that in these intimate relationships, there is someone who wants power and control over the other person. That is their goal, whether consciously or unconsciously. And all of these types of abuse are ways to gain power and control over the other person. And when they feel like they don't have power or control over the other person, or that is threatened in some way, it tends to lead to even more abuse as a way to regain that power and control. So that is something that we kind of understand about intimate partner violence and the typical patterns that we see. And there's some really good examples here in what we call the power and control wheel. So the idea is power controls in the center, and it leads out to all of these other behaviors. It can look like intimidation and threats. Lots of times people will tell me, well, my partner's not abusive. But then when they go on, even though there isn't physical violence, there is this threat of physical violence always there. And that is abuse. Or even not saying the violence, but using intimidation. Like if you punch a wall right next to somebody's face, for example, that's a pretty clear message that I could hurt you if I wanted to. And that is a type of abuse, even if it doesn't fall into that typical idea Other things that fit into the power and control that we don't always notice are things like isolation and using the children against somebody in a relationship where children are shared, saying that you have to do this or you have to do this other thing because of the kids. Again, a way to gain power and control over somebody. You can't go to this place, you can't go to work, you can't see your parents, you can't hang out with your friends. And even when these things are done in a positive way, I love and care about you so much, and that's why I want you to have you all to myself. Or a lot of times when people have violence in a relationship, they're like, I just love you so much that I just get so upset that I lose control. But it's because I care. It's because I care about you so much. So even when these things are occurring in a context that might be positive, and even that the person might feel that that is positive, it's still falling under this umbrella of power and control behaviors that is a consistent pattern that ultimately contributes to physical and sexual violence. That when these pieces are there, it often leads to or is connected to physical or sexual violence in some way in a relationship. So we actually use this wheel to educate people who are in IPV relationships about these patterns, because lots of times people don't realize how these things are connected. And what they'll say is that, oh wow, he does this, he does this, he does this, he does this, and there really is a pattern to these behaviors that we see, and can help people understand that pattern. And sometimes we see these things as normal and appropriate. There are lots of families where yelling and even threatened violence is normal and considered to be a normal part of a relationship. That's just how relationships are. And in a lot of different cultures and in our society generally, we have a long history of valuing traditional gender roles, where women and men have very different roles, and so often that involves the man being in charge and making all the power and control over the woman. So sometimes these patterns are really seen as normal because they have been normal in our culture. It's been normal in our culture for men to have a lot of power and control over women in particular. And that's why when you see some of these things, you maybe haven't thought about it as abuse, or you didn't see it as abuse, or they didn't even see it as abuse. When you take a step back and think about the patterns, maybe it is abusive, even if we consider it to be normal. Because at the end of the day, abuse is normal in terms of how prevalent it is. It's happening a lot. It's happening all around us. I think this is another helpful way to think about relationships as on a spectrum from healthy to unhealthy to abusive. Nobody's relationship is perfectly healthy all the time, right? And nobody's relationship is abusive all the time either. So there's always these fluctuating behaviors, but understanding on the spectrum that when there is these consistent patterns of hurt, of control, of isolating, of manipulating, of making you feel bad, that not only is that an unhealthy relationship, but it may be an abusive relationship. And it's always important to educate about what a healthy relationship looks like. In a healthy relationship, you should not feel afraid. You should not feel afraid that you will be hurt. You should not feel afraid that you're going to be yelled at all the time. You should not be afraid that someone is going to lash out at you and say that they don't care about you every time you do something wrong. You should feel safe emotionally and physically. In a healthy relationship, you should be able to communicate your needs. You should be able to say no to things. You should be able to be yourself without fear of repercussions in some way. And if that is not true in your relationship, then probably somewhere along this line of there some unhealthy aspects, and maybe even some abusive aspects. But again, it's rarely, that something is all one thing. But we need to understand when these things are harmful for ourselves and for our patients. I really like this one because it's really specific. Again, these are just more ways to kind of identify and think about abuse. as contrasting them with healthy behaviors. So we've got red flags, things that when you hear or observe, I start thinking, might there be abuse in this relationship? And then we also have green flags. So things that when these are happening in the relationship, that indicates there's a more healthy pattern there. Some things that stand out here for me are, that idea of respect. So consistently being disrespected in a relationship to you or to others is not okay. It's not healthy, and it can definitely be part of abuse. And when the situation is that you've become completely dependent on somebody else, that's part of what happens when someone has a lot of power and control over you. Is all of a sudden, you're not able to live on your own because you don't have access to money anymore, or you don't talk to any of your friends, or you can't use your cell phone because your partner's always reading your cell phone and getting jealous whenever you talk to people. And when you start realizing that, like, wow, I don't really have any independence, I can't really survive and do things on my own anymore. Sometimes that's not an accident. Sometimes that's part of the abuse, because that's a way to keep somebody with you when you want to have power and control over them, is to limit their options. So in terms of where does intimate partner violence occurs, it can happen to anyone. It happens across class, across race, across gender. We do see some more prominent patterns than others, even though intimate partner violence is fairly commonly reported for men as well. In terms of the degree of damage and severity, women are much more likely to be murdered by their partners in an intimate partner violence relationship. They're more likely to be hospitalized from severe physical injuries, and they're more likely to be severely harassed to the point of being in danger. So although the prevalence might be closer in terms of severity, there is a pattern of it being more severe for women in relationships with men. But it's important to remember that intimate partner violence occurs in same-sex relationships as well. Women who are with women, men who are with men, experience as high, and sometimes in marginalized communities, even higher rates of intimate partner violence. Age too, teenagers experience intimate partner violence, and we have seen over and over and over again that when you start out with an unhealthy relationship, that can be a pattern that follows you throughout your entire life, because you do start to feel that these relationships are normal, especially if you grew up in a family where this relationship was normal. You can have a hard time imagining what a healthy relationship looks like, and people might take advantage of the fact that you are used to unhealthy relationships. So with all of that said, some of the people who are most in danger from intimate partner violence are trans women of color. And because the really upsetting fact is that there is an extremely high rate of homicide for trans women of color in their relationships. And they are extremely at risk for being hurt by others. And that's something we need to keep in mind when working with that population. Okay. So what are some risk factors when it comes to who are the people who are being violent, perpetrators? Who is violent? What are the risk factors for becoming violent? Struggle, there's a lot on here, so I'm just going to highlight some that I've seen, especially here at Neon. And honestly, in the behavioral health department, I work with victims of domestic violence, and then I also work with perpetrators. People come in and they say that they are struggling with violence in their relationship, and sometimes that's with having violence in their relationship that they are doing. And sometimes people are aware of that and trying to change it, and sometimes people really aren't, because they think that it's appropriate and okay and not their fault, and they tend to blame the victim. So what type of people typically have some of this violence? There's a lot of risk factors here. Impulsivity, a history of experiencing abuse and neglect themselves, not a lot of family or social support, having a strong desire for control of the other person, substance use, belief in strict gender roles. So if you believe that a man is supposed to be a certain way, um, that might include violence. That a man is supposed to control his woman. A man is supposed to correct his woman who might upset or disrespect him in some way, and that involves either physical violence or emotional and verbal violence. And struggling generally with hostility, aggression, and anger can be a risk factor. But I think it's also really important to understand that there are a lot of people out there who are extremely abusive with their intimate partners and do not have that behavior anywhere else in their relationships in their life. They're perfectly pleasant, have no problems with anger management at work. So just because somebody seems really stable and doesn't struggle with anger, it doesn't mean that they aren't abusive. That's actually quite common for the type of abuser who is really looking to have power and control over others, because they don't really struggle with impulse control. It's that they want control over other people. So what are some environmental risk factors? So those were kind of like personal risk factors. Environmental risk factors are really, toxic stress environments when human beings are in really, really, really stressful, long-term toxic stress environments. We've talked about this over and over and over again in these seminars. They're at higher risk for all sorts of negative outcomes, and that includes struggling with being violent towards others, including their partners. So when you're kind of set up to have all this trauma and have all this anger and rage and no coping skills, no support, and you've seen a lot of that in your life, it makes sense for some of those patterns to be repeated. And that is something that we see in certain communities where there is kind of a legacy of intimate partner violence, when there is a lot of stress, and that stress can come out in the relationships. So in the room, when you're seeing somebody in primary care, OBGYN, or pediatrics, or any sort of appointment at all, what might you see as that indicate there might be signs of intimate partner violence? So obviously there's unexplained bodily injuries. Somebody who has a lot of falls and bruises. Somebody who seems very fearful, maybe they jump at different noises. Someone who's often seeking the permission of their partner, or saying, I need to ask my partner first, or I need to talk to my partner. And someone who's just really not doing well, mental health and physical health wise, that can be an indicator that something is going on in their life, and that might be intimate partner violence. Often people who are experiencing it have extremely low self-esteem, because they've been told by their abuser so many times that this is their fault and that they are worthless. Or they just believe that because this is happening to me, there must be something wrong with me. There is so much stigma about being the victim of intimate partner violence that people are very reluctant to talk about it, because they feel ashamed or embarrassed about what's happening in their lives. Because there's this idea of like that strong people don't let this happen to them. And that's not true. This can happen to absolutely anybody in the right circumstances. But people feel that way. They feel like they did something wrong and that they can't talk about it. Somebody who doesn't have a lot of connections to the outside world other than their partner. He doesn't want me to work. She doesn't like it when I talk to other people. Those sorts of things are always like little red flags for me, that I start paying more attention and asking some more questions about the relationship, to see if abuse is something that might be going on there. And you could do the same thing. So in terms of the consequences of intimate partner violence, there's a lot. So emotionally, it's going to be related to a lot of mental health problems, a lot of difficulty in relationships, difficulty interpreting people's behavior in a healthy way. So when you've been in these unhealthy relationships, it is hard to trust your own instincts when it comes to other people, and it's hard to read other people because you've been in a relationship that was operating so dysfunctionally for a long time for some people. In terms of health, there's a lot of evidence that there's increased STIs and HIV rates among women in intimate partner violence relationships, and men as well. In for a lot of physical violence goes completely unreported. People don't go to the hospital. They don't seek help, and sometimes they don't realize the long-term consequences of that. So there's a lot of honestly extremely sad research about the prevalence of traumatic brain injuries in this population when you've been hit, slapped, shoved against a wall, a door, etc. over time. And even if you never lost consciousness, or maybe you did lose consciousness, that there can be a cumulative effect. If you think of when we talk about concussions, over time having impairment in people's cognition. There's been a number of patients that I personally worked with a long history of intimate partner violence that really did have long-term damage to their brains and their cognition from that. And because people don't seek the support, maybe they have a bone that healed wrong, and in addition to the toxic stress that they're experiencing, this can be really, really hard on your body in a lot of different ways. And there are some worse outcomes in pregnancy. The risk of violence increases during pregnancy in intimate partner violent relationships. The risk of murder and the risk of violence go up significantly when a woman is pregnant. So that's often because the partner feels like they're losing control because other people are involved. This person has the ability to talk to doctors. They are focusing on another human being, the baby, and might be trying to get out and make different choices. And so it's actually an extremely dangerous time for women in these relationships. So let's talk about what might happen when you're in an appointment. So this is a little story from a patient who did talk to their provider. Oftentimes seeing a medical doctor might be the only time that somebody really has an opportunity to talk about what's going on, and they might take advantage of that. And sometimes they're looking for an opportunity. So this person went to their doctor and was talking about being depressed. The doctor was asking what's going on? And that led to the disclosure of the violence relationship. And they were actually able in the appointment to connect to resources in real time. And when you're able to do that, that's something that can be extremely effective and empowering. We'll talk more about those resources as we continue to move through. So we want to, one way that we want to be more aware of intimate partner violence is that we can screen for it. That's a theme of these seminars. I'm always telling you to screen for everything. You could do verbal or written screening for intimate partner violence. And it can be pretty straightforward. These are just 3 questions that talks about physical violence, feeling safe, and then partners from past relationships, because that's something we can often miss. People aren't in a current relationship anymore, but they're still experiencing abuse from that relationship, especially if they share children with that person. So the U.S. Preventive Services Task Force does recommend that we screen all women of childbearing age for intimate partner violence because of the prevalence and the health impacts. Another thing that we can assess for is level of danger or level of lethality. So basically the chance that somebody is going to be killed in a domestic violence relationship. And we actually do know what risk factors are associated with that. You never know specifically what's going to happen for any one person, but we do know some general patterns. And so this is the introduction of, it's called the danger assessment. It's actually a self-report item that they use to assess lethality. It's not something I would actually expect you to use, but I want you to know that it exists. And one of the things that it does identify is that choking is an extremely high risk behavior. And about 15 to 20% of deaths that occur in violent relationships occur due to choking. And when there is a history of choking in the relationship, that is strongly correlated with the risk of homicide. And so some of the other things that we know are if the person has aspect to a gun, that they are more likely to kill their partner. If there is a history of physical violence that's very severe, and threats, if there are threats of death, these are all things that we know are associated with these negative outcomes like murder. And if we are aware of situations that are more high risk, we want to assist people in keeping them as safe as possible, because we know that leaving is a very high risk thing to do. So I'll talk a little bit more about that. So what can we do? Like, intimate partner violence is really challenging because people, these are long-term situations, they're chronic in a lot of cases, and it can be extremely difficult to help support people, but there are lots of things you can do. So one is provide education about this, to provide education about the cycle of violence, about what abuse and violence looks like, about the fact that this is unhealthy, that it's not okay, that it's dangerous. You can help patients have strategies to keep safe. And I have another slide about that. You can connect them to resources, not just about intimate partner violence, but resources generally that will help improve their stability, like housing and childcare, et cetera. So some important things to know are that on average, it takes people 7 attempts to leave an abusive relationship. So realistically, when somebody leaves, it's extremely likely that they will go back and continue that relationship after a short period of time or a long period of time. And that most murders occur when a woman leaves, 75%. So leaving is an incredibly risky thing to do, which is one of the reasons why people are so reluctant to do it, and why connecting to resources is so important, so that we can improve people's safety when they are leaving relationships. How can they do it as safely as possible? So what can we do at Neon about this? We can be aware that it's happening, and have that approach of being trauma informed means that you are aware that a lot of your patients are experiencing this, and you're looking for those red flags. You're asking those questions. If you're screening, it gives people permission to talk about it with you when they probably wouldn't if you didn't screen, but because you screen for it, they know that you are a safe person to talk to. And being sensitive to the fact that people might be in these violent relationships, and that might be impacting their health. They might not have a lot of control over their lives, and that might be one of the reasons why some of the things are happening with their health. And respecting their right to talk about something or not talk about something, respecting their right to stay in the relationship or leave the relationship. And being trauma informed means respecting people's choices, and giving them the opportunity to have more information and resources and education. And we also want to advocate for resources, for more shelters, for more housing. Longer term housing is always a need. Short-term housing is one thing, but then what do people do when that's done? And lots of people don't want to bring their families into a shelter, which is understandable. So the more funding that we can have to give people options, the better. So I feel like I somehow lost my safety idea slides. Oh no, it's because it's not a slide. Okay, sorry. So some examples of the safety behaviors that we can help people with, and I'll send out a document actually that's a whole long list of them, because I think it's really helpful to see. You can do things like hide an extra set of house keys or car keys, so that if somebody takes those away, you still have access to them. You can have a code with family and friends, so that if you call them or text them, with a specific code word, they know that you're in danger and to come intervene. You can try to hide money, so that when you are ready to leave, you have access to money. And you can prepare for leaving by getting documents together. A really important part of being safe is trying to create environments where other people will be around. And that way, abusers are less likely to hurt you when you are in public. And I think it's really important to remember that people who have been in these relationships for a long time, they know how to keep themselves safe. They've been keeping themselves safe for years. And by that, I mean they've been trying to say the right thing, do the right thing to avoid setting the other person off. And they've been or doing a million different things that have helped keep them safe. And so working with them to understand what they're already doing and then building off of that with some other ideas can be really important. A really big thing you can do is encourage them to tell other people about it, because if other people know, it'll be easier for them to get help when they need it. That can be really scary, because if other people know and it gets back to your abuser that you talked about it, there could be really bad consequences for that. It's really important to be aware that there are very real safety risks to these conversations, and that's why we need to follow the lead of the person that we're working with. Okay, sorry, going back. So what are the resources that we have? There's a lot of national organizations, but I really want to highlight Journey. They have a 24-hour helpline, shelter, support groups. They have trauma-specific services that are free. They have justice system advocacy, which means that for court, custody, et cetera, that someone might need following an intimate partner violence relationship, they go with you through that process. Journey will help you file a protection order, also known as a restraining order. What happens is that when there is a threat to your safety from an intimate partner, so if someone threatens to kill you, or if they actually hurt you, or you have any reason to believe that they will do that, you present that evidence to a judge, and the judge grants, and you do that like through a written document that, again, Journey would help you do this. You fill out that documentation, you get it to the judge issues a emergency protective order. The protective order is then taken to the person. So let's say if I took out a protective order against somebody named Steve, the police then bring the protective order to Steve and they say, you are not allowed to be in the physical vicinity, or it sometimes names specific places, like you are not allowed to be in Kathleen's home, or you're not allowed to be at her work. And if you violate that, you will be sent to jail until they have a court date, and then they decide about the protective order going forward. So you have an emergency protective order that lasts until the court date, and then at the court date, a long-term protective order can be put in place. But emergency protective orders, if I don't want to say they're easy to get, but if there's any evidence that you are in danger, you should be able to get a emergency protective order from a judge. People say, what does a piece of paper matter? You're right, a piece of paper isn't going to do anything to protect you. But what a piece of paper does is that if somebody doesn't follow the rules on the piece of paper and the police are there, they will be arrested. So normally if I say, don't come in my house, and somebody comes in my house, they're not really going to be arrested, especially if they're my partner, right? Or that they also live there. But if I have a protective order and somebody comes in my house and they're not supposed to, then they'll be arrested. So that's the value of a protective order, is that it can be enforced. But obviously it's not a promise of safety. And in fact, it has to be delivered to an abuser who people always say, well, what is he going to do when he gets that? And that's a really valid question. He might do something really scary and dangerous, but if he does, then he's probably going to get arrested for violating the order, because that includes things like messaging. So if somebody messages you when you have a protective order and they know that they have a protective order, that's going to get them in trouble. So it's all about documenting. Number one advice I give people, didn't mention this before, in these types of relationships is to document. That can mean taking pictures, recordings, writing things down on certain days, filing police reports, so that you have this official documentation of things that may have occurred. Then we have some other resources that are available in Cleveland, and connecting women to these resources is really important. You can go on the website together, you can call the hotline together, and if somebody calls the hotline and they're like, I don't need emergency shelter right now, but I might need it in the future, that's actually really smart, because then they get all of your information, and then when you call and you need emergency shelter, they're able to take you in. But if you need emergency shelter and you're calling them for the first time, it kind of like it's slowed down, right? They have to get more information. So that's another tip that can be really helpful. All right, and want to do this slide. So that is all I have. I know it went over because I started late. This is a really important topic, so I hoped people wouldn't mind. Any questions? I'm going to make sure I get a picture for attendance. And questions can be asked privately. Oh, and in case anyone's wondering, Dr. Watson's asked me to continue taking attendance. So we'll have an attendance records for the seminars that I am able to do before I leave. And then I'm not sure in terms of what the requirements will be after I leave in terms of fulfilling the seminars. Because we'll be like halfway through the year at that point. All right, I'll stay on here for a couple more minutes in case anybody wants to talk, but otherwise, please log off if you are ready to go. Enjoy your lunch. Thanks for joining. And Ms. Turner, I see you on here. I know you do a lot of work with Journey, and I wish I'd noticed you weren't here before because I would have loved to get any hot tips from you that you have for working with this population. All right, doesn't seem like anybody has anything to add, so I'll be logging off. Thanks, everybody. Oh, I gotta stop the recording.